Hey there, if you are watching this video, odds are pretty good that you are either looking for a job because you need one right now. Perhaps you're not happy where you currently are. Maybe you're starting to feel the burnout that impacts literally almost every outpatient physical therapist I've ever spoken to. It happened to me about 10 years ago as well. Or maybe you're just browsing because you're kind of starting to feel like, let me see what else is out there. I am Dr. Carrie Jose and I own CJ Physical Therapy and Pilates. I'm talking to you because I want you to know what a special place this is. And if you are looking, I'd love for you to talk to me and consider this as an option. We're a cash-based physical therapy practice, which means we don't take any health insurance. Now, some people hear that and they freak out, they get intimidated, they think, oh my gosh, I'm gonna have to sell, I'm gonna have to find my own patients, I'm gonna have to do all these things. So the good news is you don't have to. I have tried to create an environment that is all about you and being able to focus 100% on your patients, okay? And what that looks like is you have a fully supportive, highly trained administrative team. They do most of the work for you in terms of getting patients on your schedule. I train them very well. They talk to people on the phone. They get them super excited to come in so that your number one job is to show up as your best self, as your best clinician, and just make patients happy and help them get the results that they're looking for that they usually can't get other places. So the benefits, the huge benefits from a fulfillment standpoint and work-life balance and satisfaction goes is really about 6 patients a day, 6 to 7 a day. You have plenty of time to get your paperwork done here. And when I say paperwork, it's electronic notes. No insurance, no insurance authorizations or anything like that. We do Pilates here, which is pretty cool. Love incorporating that into our patient treatments, and I'll teach you how to do that. We have amazing Pilates instructors. So the other nice thing is that we really focus on long-lasting relationships and results. So our clients come in, and it's not your typical like twice a week plan of care. We will see patients 1 to 2 times a week, but we'll see them for a longer period of time because we base our treatments off of what they need versus what the insurance dictates. So we'll see patients, we kind of talk about our 3 phases of care, where phase 1 is kind of traditionally what you'd expect from getting physical therapy treatment, where you come in, figure out what's wrong, and essentially feel better, get the pain gone. A lot of people wouldn't call us by the end of phase 1, but where we really shine is in phase 2. We focus on helping patients keep their pain gone. So we get to actually work with them when they go back to their sports or their favorite activities, hiking, tennis, pickleball, golf, whatever that may be. Sometimes it's just enjoying life, retirement, right? They want to travel and do fun things with their families and grandkids. And the last thing they want is something like back pain or knee pain to get in the way of that. So phase 2, we might see patients once a month after that, or every couple of weeks. You get to decide, you get to prescribe their plan of care. You get to do what you went to school for and actually use your knowledge and skills to do what patients need instead of what an insurance company is demanding of you. And then our phase 3 is sort of optimization phase. Sometimes patients will continue to do check-ins with you on a monthly basis, tune-ups. There's nothing wrong with them. They come because they want to come, because they believe in you, they want to be held accountable, they want to improve, not stagnate, or they'll join our Pilates program. So it's very unique and different in that you really get to build if you love people, you love the profession, and you're passionate about physical therapy, and you really, really thrive on being around people and building long-term relationships with clients, this is definitely a job for you. And I would highly recommend you send in your resume and talk to me and see if you'd be a good fit. We have an amazing team. We're growing. We've got a lot of fun things in store. There's lots of room for growth and leadership potential here because we are small and we're expanding. So we've got, and for a small business, we've got all the good stuff too, paid time off, benefits, things like that. So I know there's a lot of competition out there right now, and I'd like to just be that diamond in the rough that you might be looking for. There's more to work than just, kind of benefits and pay and all that stuff. That's certainly important, and we're competitive in that aspect, but there's also this thing called fulfillment and job satisfaction. You got to remember, you're spending 1/3 of your life at work, and you want to really pick a place that that cares about you as a person. One of our core values is person first, patient second. That goes for our team as well. It's person first, right? Employee second. We care about your development as both a clinician and a person. And one of the things, I was a burnt out therapist. I created this place because I couldn't stand the establishment anymore and the insurance. And I never want another physical therapist to feel the way that I did. So I've created this place to have it be a happy place. You know, come to work. Yeah, you're going to work hard for your patients, but you're going to do it in a way that is so fulfilling and satisfying. So hope to hear from you, and maybe you'll be a future member of our team.